With the headlines filled with stories of Hollywood celebrities checking into rehab, more and more attention is focused on battling drug and alcohol addiction. Dr. Richard Gracer has a new book out. It highlights his new plan to help people kick the habit. It's called A New Prescription for Addiction. And Dr. Gracer joins me this morning with a look at how it works. Good morning. Thanks for coming by.
Thank you.
Let's first start with these rehab programs because they've been in the news so much. More and more, we're seeing celebrities, they check in for maybe a few weeks, even in some cases a few days, and they're right back out again, and then they're in trouble again. And you're saying, you know, they need a longer stay, really.
Well, it's not just a longer stay. What they need is a longer program which will help keep track of them and help support them on an ongoing way. At our program, we have something called the Recovery Maintenance Model, which keeps them engaged for at least a year. When somebody comes into our program, they know they're signing up for a minimum of a year.
So somebody's going to be in contact with them on some level, walking them through for at least a year. And why do you think you need that much time, at least that much time?
Well, it takes a long time to heal this problem. This is a multifactorial problem. You've got problems with a brain disease, which is very, very important to treat, which is undertreated and very often not treated at all. There are psychiatric problems, there are nutritional problems, and going right back into your regular life routine is a disaster because obviously...
That's the one that got you there in the first place.
Right.
Which is interesting because, you know, you look at these programs and the way they work, and you're saying because all these different elements are involved and everybody's unique, kind of a one-size-fits-all thing doesn't apply. You really have to custom tailor to each person.
Right. In other words, we do an intake and we really evaluate what person's problems are, and everybody's different. First of all, what drug are they using? I mean, a lot of substance abuse problems are treated in clinics where everyone is a substance abuser, and therefore everyone's treated the same way. You have to admit it, and so forth. The disease is substance abuse. Our point of view is that everybody's different. Yes, you have a substance abuse problem, but you're a human being. There are many, many factors, including, as I said, treating the brain disease, which is really what causes relapse.
So in other words, somebody, if you have a meth addiction, that would be different than, say, an alcohol addiction, which might be different than, say, a heroin addiction, something like that?
Yes, of course. And if you are very well-to-do and you're a movie star, it's different than if you're somebody who doesn't have any major financial means.
And you talk a lot about helping people in kind of the middle class area. Why that particular group of people? And I guess you're saying that it's more common, these addictions, than you might think, that it's people that have families, they have jobs, they're well-meaning, middle-class, average Americans, but those are the ones you're seeing and needing to treat a lot.
Right, we call them the hidden in the book. And in any given population, looking over even the studio or any place you go, a restaurant, whatever, about 13% of the population, that's sort of a rough number, has got problems, not counting smoking, but alcohol, drug problems. That's a lot of people. And who are they? And can you tell? I cannot tell by just looking at a crowd that this person has a problem or that. Also, a lot of these people are desperate to stop. They just don't know how. In other words, when you start using drugs, sometimes you do it for a reason, to get high, have a good time. With meth, it might be a college student who wants to stay up and study. But pretty soon, your brain gets diseased, and it flips over until you've got to use this medicine or whatever it is you're doing in order to feel almost normal. So then what do? Now you're trapped. And up till now, of course, people go through this revolving door situation where they get treated, they go out, they get treated, they go out. And now what we can do differently for them is to start treating the underlying brain problems, which really helps a lot.
And really treating the whole problem, as you mentioned.
Right, that's right.
Very good. Well, and that's just a tip of the iceberg of the type of program that you do, but we thanks for coming by and at least sharing some of it, get us started on the right page.
Thank you for having me.
Sure, no problem. Right now.